Hi everyone, welcome to Therapeutic Tools of the Trade webinar for April. This one is all about KPIs or key performance indicators, which is a bit of a corporate term, but where we're going to be talking about them, yes, the business side of things and why tracking some of these numbers can be really helpful, but also how clinically they can be really useful to help deal with those annoying little voices in your head that sometimes say, your clients are not getting well fast enough, or am I doing the right therapy, or all of the imposter syndrome questions that can crop up from time to time. So this is all about, yes, how do we work out those numbers, but also why they are useful to us clinically and financially. We're going to be looking at why we measure KPIs in the first place. Like I said, I think there's a lot of corporate jargon and badness associated with KPIs, and I want to kind of dispel some of that when I'm talking about KPIs and when I'm encouraging you to look at your own KPIs. We're not doing that as purely a bottom line serving exercise. We're doing that because clinically it's really relevant, and yeah, financially it is relevant as well, and you can't ignore that part of it. But there's a lot more to them than just ticking a box. We'll look at what KPIs we actually measure, and what each of them mean. When someone is presenting you with your cancellation rate, what does that actually mean in practice? Where does that number come from? And why is it useful to know that number? And then we're going to talk a little bit about how do we make our KPIs and KPI tracking work for us. And again, that will be financially and business-wise as well as clinically, because there's a lot of really good clinical information we can get by tracking our KPIs, and I'll talk a bit more about that. So I want to start off with if you've attended or watched any of the other trainings, you'll know that I like to spend a little time talking about why we're doing this, because as you'll know from your work with clients, any type of behavior change is hard, and we're not immune to that. And knowing why we're doing something and why it has personal relevance to us will make it a little bit easier, especially if you're someone like me who at first didn't really like doing the stats and the numbers. It made it much easier for me to go, wait, well, why am I actually doing this again? This is not just a box ticking exercise. I'm going to get clinically useful information out of this. So therapy is about relationships. We go on and on and on and on and on about this. But I think sometimes we don't really stop and think about what it means in practice. Yes, a therapeutic relationship is different to, a friendship that you create at the gym or at your Pilates class or online or wherever it might be. But all of those relationships are different, and very few of them are time limited. You don't start a relationship with someone by saying, yeah, we're only going to be friends for 6 months and then we'll probably have enough and we'll be good. It's a different type of relationship. It's a strange relationship, but it's a relationship, and it takes time to build, and it takes time and skill to make that relationship the important and key part of the therapeutic alliance without crossing boundaries and that kind of thing. But the other key thing to remember is that therapy takes time. It takes time to build a relationship, takes time to build the trust, but whatever therapeutic modality that you use, you're still going to need time. The classic example of this for me is with EMDR therapy. I love EMDR. I think it's amazing. But what I've noticed over the last couple of years, especially since it's become a little bit more well known and we've had like Prince Harry talking about it and stuff, clients think they can just come in for 1 or 2 sessions and you're going to wave your magic wand, literally, and they're going to be fine and it's all going to be done. And what I've discovered, and my population that I work with is a lot of personality disorders, complex trauma, that kind of stuff. So those clients tend to be more challenging to build that relationship and to build that trust. But also from supervising other clinicians and from people who've worked here in the past, even if EMDR itself can be a really, really effective short-term treatment, if that relationship isn't there, if the client doesn't trust you and what you're doing, it's not going to work. They're not going to allow themselves to get emotionally connected to the source material, which means it's going to be much, much more difficult to process that and to create any kind of progress. They're not going to trust that their stabilization is effective enough to deal with any of the big emotions that are going to come up. It's crucial that we take our time and we foster that relationship. And KPIs help us figure out, how are we doing that? How well is that working for us? If the most important factor in therapeutic recovery is relationship and therapeutic alliance, then that's, I think, really what the KPIs are showing us. How are we doing at building that? So it helps us also to deal with that imposter voice by giving us a realistic comparison. So instead of freaking out because you've had 3 people drop out, looking at your KPIs over time allows you to look at it and go, well, the expected dropout rate at 1 or 2 sessions is around about 30%. And I've only had 3 people drop out of 20. So I'm actually well below the normal expected dropout rate. And that normal expected dropout rate is usually more to do with client-related factors than therapist-related factors. If we start getting more than 30%, and we're consistently getting more than 30% dropout rate, then there's going to be therapeutic and therapist factors in there as well. And monitoring our KPIs and checking in on that helps us figure out what normal looks like for us, how that compares to sort of industry standards, and also helps us figure out, well, which clients stick around the longest? Which clients do I seem to have maybe more of a natural affinity for working with? All of my eating disorder clients seem to drop out at 4 or 5 sessions, but my chronic pain clients stick around for 20 or something like that. It helps you figure out what might be your niche area, what might be an area where you want to spend more time getting those clients in, and what areas maybe you need more work on. Maybe you need to develop your training in those areas, or maybe it's just not an area where you feel particularly comfortable and the clients are picking up on that. There's so much clinical information that can be pulled out and gleaned from looking and monitoring your KPIs. With proper interpretation, obviously. You don't just look at the number and go, that means that. You've got to look at the big picture. But this is why doing it consistently is really, really useful. And really, at the end of the day, all of this clinically is about giving us some evidence to dispute the imposter syndrome. If you're a CBT therapist, then you know you need a little bit of evidence sometimes to dispute the automatic negative thoughts. Excuse me. And but also allowing us to actually take a moment to stop and appreciate our successes or our achievements. Be able to, when we've had a client who has unceremoniously, dumped us, it gives us a chance to, look back and kind of go, okay, but that was, that was an anomaly. If I'm feeling really, really bad and like I could have done more, or I should have done something different, yeah, maybe, but the evidence suggests that this was more likely a expected normal client-related dropout, or no, actually there's a problem here. And this has been really useful for us as a group private practice. In a couple of cases, it's actually helped us. We do these KPIs every 6 months. Some places do it every 3 months, some once a year. We settled on 6 months. That we've noticed sometimes trends in the data that have helped us identify that there's a clinician who's having a problem. And we've been able to go and speak to them and say, are you okay? What's going on? There's just been this trend in your numbers lately that is really different for you. What's going on? And it was able to open up a conversation about what was going on for them, so we could address it and deal with it, and put some things in place to improve their KPIs. But the important part there was it helped us to help them, which is kind of what we're all wanting to do in this job in the first place, or wouldn't be doing it. So those are just some of the clinical applications of figuring out your KPIs, and why it can be a good idea to know what your normal numbers are, and to get a little bit of a baseline for comparison. The other big thing that it's really useful for is, and again, I find this particularly with the newbie psychs, but us old timers struggle with this sometimes as well. I have so many new supervisees who will say things like, oh, I want to talk about this client. I'm really, really struggling with them at the moment. I'm feeling really stuck. And my first question is always, how many sessions have you had? And if they say 2 or 3, I say, you're not stuck, you're still formulating. You haven't really started therapy yet at this point. We've got this idea between Medicare and the 6 sessions, and the medical model of psychology and mental health that most of us were trained in. We've got this idea that it does all happen very, very quickly. And that's not terribly helpful to us or to the clients. So monitoring your KPIs and learning a little bit about this stuff, I think, is massively important when it comes to, again, realistic comparisons. Knowing what the average number of sessions most people need to achieve therapeutic recovery versus this idea we have in that 6 sessions is some sort of magic cure-all, I think is also a really important reason to look at some of this stuff.